Hello, my name is Sarah Napati. I am the clinical educator for medical surgical here at Mount Vernon. Today we are discussing how to search policies on INOVANet. We want to look up policies routinely to keep up to date on new and revised policies. We also look up policies prior to performing high-risk, low-volume procedures.
Hi, my name's John Lawrence. I'm the sepsis coordinator at Mount Vernon Hospital. I'm going to show you how to search for a policy. If you're in a room and you have Epic pulled up, you can pull up INOVANet by clicking at the top. You should have in this top bar an INOVANet link. So if you click on this and then go to Policies, you can click on that tab and it brings up a search option. So as an example, I'm interested in finding out what to do if I have a critical lab value. So I'm going to show you a couple ways to do this. So first of all, I'm going to type critical lab and search. And you can see in the results down below that there were no records. So there's a couple things I could do. When you search by default, it's only searching the title. So if you click the advanced search options and check search body of policy, it's going to search not just the title, but all of the text in the policy. So I'm going to try it again. So now I have some responses. I see pediatric rapid response, and I'm just looking for one that would apply either to the system or Mount Vernon. So I have a laboratory critical values, but if you look carefully, it's just Fairfax, so that doesn't work for Mount Vernon. But I can see that they called it critical values laboratory, and so sometimes the search is very particular, so I'm going to, instead of saying critical lab, I'm going to type in critical values and search and see what happens. And this time at the very top, I have critical values for inpatients. And this is a system-wide policy, so that looks like what I'm looking for. So I'm going to click on that, and it wants to open a PDF, so I'm going to say open. And so here's the policy. And I can double check that this is a system policy by scrolling down, and it says it applies to inpatient units. And so here's my PDF. And so I can see my critical values policy. So that just illustrates that sometimes to find a policy, you have to type it in a few different ways, and don't forget that if you're having trouble, you would need to check under advanced search options and search the body of the policy. So let's look at a couple example scenarios to see what this would look like in action. Scenario, I'm getting a stroke patient from the emergency department, and in report they told me that the patient passed the swallow screen and has a diet ordered. So my question is, do I need to repeat the swallow screen once the patient gets to me? So here I am on the policies page, and I'm going to try typing dysphagia screen, see what happens. And as I scroll down, the only thing I see is something for Inova Fairfax Hospital. I want to make sure that I've selected search body of policy. So I'm going to try searching it again. And now I have some things that have come up: advanced triage protocol. I have some stroke policies. So I have Mount Vernon is the first, and you can see down below that there's another Mount Vernon emergency services. There's Loudoun stroke policy. So just be careful that you're finding the one that applies to your hospital. Now, I see that the revision date for this one is 2018, but this one's 2019. So I'm going to click on the more recent one. And this policy is 9 pages long, and I can scroll through it and read it, but I'm going to try Control F, and I'm going to type in dysphagia because that's what I'm interested in. And I see here that the patient should be NPO until they pass the swallow screen, but I was told they already passed, so I'm going to keep searching. This is about education. And I get to addendum G, it says dysphagia screen protocol. So that seems promising. I'm going to click on that, click allow, and then click open. So this is the Mount Vernon stroke policy dysphagia screen protocol. So it says that the RN swallow screen must be documented for all suspected stroke patients on admission to the emergency room and on admission to a stroke unit. So that answers my question. And then let's say I've done the swallow screen and now the patient actually is having some slurred speech and they're not passing part 1. So what should I do? So if I have yes to any of the questions in part 1, the patient should be made NPO. And I should not go to part 2. And it says I should place the following orders per protocol: NPO diet and a speech evaluation. And then I should educate the patient and family about aspiration risk and notify the provider for method of medications and nutrition and hydration considerations. So that answers my question. Let's do another example. This time I'm interested in finding out how to access a port. So if I type in the search access port, it comes up with several options. And I just want to point out that I've actually done this search with the checkbox to search the body, because if I hadn't, this would not come up. The central venous catheter, double checking, it's a system-wide policy. So I want to open this one. And when you look in policies, you should be familiar with the policy. It starts with definitions, but the procedures section comes at the end. So if I scroll towards the end, I have the different addendums and procedures, and I'm interested in the implanted venous port. It's right here. So I'm going to click on this blue link, and it's going to actually take me to the lip and cut procedures for an implanted port accessing. So you can read the policy here. It has some pictures, but you might want something to bring with you to the bedside that's a little simpler, and Lip and Cut has these quick lists. If you click on that, it gives you a simplified checklist of what to do. So you could print this out and take it to the bedside with you. There's a print icon up here at the top right.
Taking care of a patient on 3B. The doctor ordered for her central line to be removed. My skill checkoff for central line removal is up to date. I want to review the policy and pull up the checklist for central venous catheter removal. The central venous catheter policy is a system policy. So I'm going to go here to clinical and then go to system wide. All the system wide policies are in alphabetical order. So I'm going to scroll down till I get to central venous catheter. I'm going to click on central venous catheter because that's the entire policy. I'm going to click open. I'm going to scroll down and verify that only specially trained team members with documented competency may remove non-tunneled central venous catheters. I can go to Addendum J, Central Venous Catheter Removal Checklist, to pull up the checklist. And here it is step by step that I can print out.
Lastly, let's do one more example. This time I'm interested in finding out how I'm supposed to flush a suprapubic catheter. So I'm going to go here and type in suprapubic and see what happens. And nothing came up. I want to make sure this is now checked and try again. So I have some results, but it's about a vaginal birth after a C-section. So I could try some other options, for example, urinary catheter. And so it does show up, and it's a system-wide policy. So I'm going to open this up, and there's some different search words here. I can scroll down and look, and if I'm having a hard time finding, I can do Control F and type in suprapubic, and nothing is coming up in this document. So this is an illustration of when you're trying to look for a policy and you can't find it, what should you do? So you should talk to your manager or one of the clinical educators or mentors you're working with. And if they can't help you, you can always reach out to the chief nursing officer on what our policy is and where to find it.
To recap on policy search, we look up policies to stay updated on new and revised policies. Reviewing high-risk, low-volume procedures prior to performing them is often a good idea. We should be only using system policies or policies from the hospital where we work.